Hi, my name is Mark. I'm with Wilderness Medics, and today we're going to talk about the B.I.G, bone injection gun for interosseous access. Before we get started and demonstrate how to use this, we're going to talk about when we use it and when we don't use it. We use this when we do not have vascular access or adequate vascular access for this patient. So when do we not use this? Well, we do not use it if there is a fracture on the same side. We do not use this if there is a bone proximal to the insertion site. We do not use it if there is an infection present anywhere around the insertion site. And we never use it if we have good vascular access already. There is no reason to use an IO if we have good vascular access to start with. So now we have to know how to find our landmarks for where we use the IO at. So I'm going to have Molly come up and we are going to find the landmarks together. You're going to take the side of your hand and we're going to bisect the deltoid, just like that. The other hand, the exact same way, like a karate chop, and we are going to bisect the axillary. Once we do that, we're going to press our thumbs in and we're going to work up until we find the surgical neck of the tubercle. Now, the surgical neck of the tubercle is going to feel a lot like a golf ball on a tee. Once we find that, right there, we are going to go approximately 1 centimeter above that. And that is going to be the site of our insertion. So before we insert, we're going to take and use an aseptic method to clean the site. We are going to place our B.I.G at the appropriate landmark. We are going to twist the top to remove the safety, place our 2 fingers, our index finger or middle finger, underneath the wings, press our hand over the top, and we are going to push down, which is going to cause the spring to deploy and cause the IO needle to go into the bone. So now I have a cow femur that I have previously inserted an IO into. And we're going to take it the rest of the way from here. Once you have your IO established, we are going to take our stabilizer and we are going to put it right over the top of our blue hub. And then we are going to remove the needle. Once the needle is removed, we are going to attach our extension tubing. And once our extension tubing is attached, we are going to administer 40 milligrams of 2% lidocaine. We're going to do that slowly. And once it is in, we are going to let it sit for 60 seconds before we do anything else. Once the lidocaine is sat inside of the osseous space for 60 seconds, we're going to come back and we are going to flush the IO to make sure that we have sufficient flow. Once we have done that, we can go ahead and hook up our IV tubing and start to administer both our IV fluids and our drugs. Now, this is only for those emergent patients where you cannot establish vascular access in a timely manner, and if that vascular access is not sufficient enough to move the volume of fluids and the amount of medication necessary for the intervention with this patient. Thanks, and have a good season.